There's something I see on a lot of birth plans that I don't necessarily agree with. I used to, but I've changed my mind because of new information and new research, and that is no episiotomies. I agree with this somewhat. I don't think we should be doing routine episiotomies as a way to try and prevent tearing. In general, what we've seen is that we don't necessarily want to do routine episiotomies on someone who's just going to tear, maybe a grade 1 or grade 2 tear. It's better to just let them tear naturally where they're going to tear, rather than do a cut, because that can lead to worse outcomes. However, I don't think that we need to throw the baby out with the bathwater, because in patients who are already at a really high risk for severe perineal tearing, I'm talking grade 3, grade 4 perineal tears going all the way through the anal sphincter or partially through the anal sphincter, there are cases where episiotomies can help to prevent that. So I'm talking about people with clusters of risk factors, things like Asian ethnicity, very small perineal body, difficulty descending their pelvic floor, type 1 diabetes. Somebody has all of those risk factors and they're maybe looking at having some severe tearing when they have their birth. It might be worthwhile to say, if an episiotomy is needed, let's do an episiotomy to avoid tearing all the way through my butthole. If during the birth someone ends up needing to have a forceps or a vacuum delivery, in those cases we can also see a big risk for anal sphincter injuries, which can then be reduced by potentially doing a mediolateral episiotomy. This is obviously always a conversation you should be having with your doctor. When do they do episiotomies? When do they not? How do they do episiotomies? Because that also matters. Are they doing a midline episiotomy, which generally should not be done these days, or are they doing a mediolateral episiotomy? It's worth understanding that there's a lot of nuance to these conversations, and it's not always helpful to have a blanket no on your birth plan, because there are some cases where it might be helpful.